Hey, with these numbers today, sorry, I'm just trying to get in. With these numbers today, will you admit that your strategy has failed, that you have failed? Sorry, if I can just finish. And you said the settings were right. That's not true. And National Cabinet's going to decide it was a short, sharp, hard lockdown was the way. Can you see now that you've made a mistake there and the strategy is failing? And this death of 1,000 cuts, a little bit of restrictions every day just isn't working. You have to come down hard.
Well, we have harsher restrictions in place than any other state has ever had. And even if you look at mobility data, which we have access to, the vast majority of our citizens are actually doing the right thing. If you compare our mobility data to when Melbourne was in lockdown, the vast majority of our citizens are doing the right thing. But as we know, the Delta strain is a complete game changer and it is so contagious. And we also know that it only takes a very small number of people to do the wrong thing to cause ripple effects, which can cause a setback.
So you haven't
and of course, all governments are making their way through the Delta strain around the world. There is no perfect way to deal with a pandemic, and we've been far from perfect. And I would have made that comment 18 months ago. We've been far from perfect. But if you look at other places around the world and the way the Delta strain has taken over communities, even when vaccination rates have been much higher than ours, we can take some comfort in the fact that today we haven't had thousands and thousands of cases, thousands of people in hospital and many more deaths. And that's what these lockdowns are about. It's about preventing that severe illness, it's about preventing death and keeping the community safe. And once our vaccination rates go up, obviously then we can consider the way forward. But it's really important for us to acknowledge that had we not done what we've done in the last 5 weeks, the situation would have been far worse. And I'm never going to suggest we get everything right. I don't think any government around the world can say they get everything right because there's no rule book. And I'm the first one to admit, at every stage of the process in the last 18 months, with the benefit of hindsight, it'd be wonderful to know what the alternative course is, but we will never know that. But what I do know is that compared to other places in the world, as difficult as it is now, we've kept thousands of people safe and thousands of people healthy, which otherwise would have succumbed. And as Dr. Chant, Minister Hazzard and myself and everybody in the team says every day, the vaccines are working. The vaccines work. Touch wood, I'm yet to be advised of anybody in intensive care who's had both doses of the vaccine. And based on that, we really need people. It's a call to arms. Please come forward and get vaccinated, especially if you have older, vulnerable people in your community, because with the numbers the way they are, and as I said, I'll always say it like it is, with the number of infectious people in the last few days in the community, it's likely case numbers will continue to rise before they start coming down, and that also means more deaths. Protect your loved ones. Don't take the virus home. Don't do the wrong thing, and please come forward and vaccinate.
Premier.